top, introduce yourself, verify your patient, practice the 5 review systems for neuro so that you don't forget your review systems. Then I'm gonna try and go down, right down the checklist so that you don't get lost. You can change the order later if you want to, because some of them kind of jump around a little bit. So I'm gonna do a cranial nerve exam on you, so I'm gonna check really just the head and neck stuff. Is that okay with you?
Yes.
Okay. Can you verify your name and date of birth?
Jasmine Major, 13097.
Okay, perfect. So first, I'm gonna have you cover up one side of the nose and breathe in, and then switch. Good. Now I want you to close your eyes, cover one side, and I'm gonna have you smell this. Tell me the best that you can what that smell is.
Eucalyptus.
Okay. And then switch. I don't know how strong they are.
I think that's peppermint. I don't know. Or that might have been eucalyptus. One of those for eucalyptus.
Peppermint. Good. Okay. So now I'm going to do the optic cranial nerve. This is cranial nerve 2. It has a couple of different components. So first, hold that about an arm's distance away. Cover the right eye and read the lowest line that you can.
Oh boy, I'm blind. 5, 6, 3, 2, 9, 7.
Okay, good. So it's 20/30. Now cover up the other eye. Read the lowest line that you can.
6, 8, 3, 2, 7, 9.
Perfect. That was 20/25. Now uncover that eye. Read both eyes together.
Okay. 3, 7, 2, 8, 4, 6.
Okay, good. Which line was
I think that was 2020.
it? Okay, good. Did you have double vision at any point?
No.
Okay, good. So that's checking. You need to check right eye covered, left eye covered, and both together. Now visual fields by confrontation. So sort of like an arm distance away, cover one eye, right or the left, okay? In between the patient, tell me when you see my wiggling fingers.
Now. Now. Now.
Good. Oh, keep
Oh,
that eye covered. Tell me when you see my fingers.
Now. Now. Now.
Good. And then switch eyes, and we do the exact same thing again. Now both eyes open. Can you see them out here?
Yes.
Can you see them out here?
Yes.
About out here?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Good. Double vision with any of that?
No.
Good. So now you evaluate the optic disc with the ophthalmoscope. So light off. Can you take your glasses off?
Sorry for the dark eyes. Probably won't see anything in there.
Good. And you're looking for the same things that you were before, but really the specific point is the clear edges and sort of the disc itself. Okay, so then the next thing is the optic and ocular motor, which is really hard to kind of separate which component is which. Some of it is sensory and some of it's motor, so we just keep them close together. And it's going to be with the light. It's going to be pupil size, so looking right to left, do the pupil size match, you know, and is it, you know, a couple of millimeters. You can use your Snellen chart, should tell you. And then you're going to do direct and consensual light. So direct, consensual, direct, consensual. And so you're looking for the constriction, and the constriction right to left, no matter which eye you're shining it in, is the same. So that's reaction to light. Then you do the near response. So you're gonna have them look at your finger far away, which should dilate the pupils, back to the finger, near, and then if you do convergence, that they're continuing to constrict and that the eyes converge. So that's 2 and 3 that are together, that are hard to separate. And then we have 3, 4, and 6, which are gonna be the cardinal direction or field of vision. So follow my finger with just your eyes. Good. Any double vision with that?
No.
Good. So you're looking that she can actually follow in all of those directions with both eyes without moving her head, that she doesn't have double vision, okay? Then 5, trigeminal has 2 different branches. It's gonna be the motor and the sensory. The motor is feeling the sort of muscles of mastication, and so make sure your hands go on the face in the relaxed state. Then clench your jaw, and you're feeling both that the temporalis muscle and the masseter muscle clenches, and then relax. Good. The sensory is the 3 branches of the trigeminal area on the face, using sharp and dull. So I took a cotton tipped applicator. I'm gonna tell the patient what is what. So this is dull and this is sharp. Can you tell the difference?
Yes.
Shut your eyes, and then you want to sort of touch various places. Is that sharp or dull?
Dull. Dull. Sharp. Dull. Sharp. Dull.
Try and get, you can open your eyes, try and get every single area with either sharp or dull. Try not to have a pattern, and very sort of the speed at which you do it. And because if I did sort of every other one, she would catch on. And if my timing was perfect, she could also kind of fake that as well. The corneal reflex, I'll show you the right position, and if you guys want to, you can do it on each other, but you don't have to. It's something that you just state, okay? So if you look up that way and away, you pull this so that there's just a tiny little wisp of cotton, and you're putting it right on the edge of the cornea. What's the normal reaction? Yeah, both eyes closing. Okay, so the facial has, again, a sensory and motor. So first you ask them to sort of do facial movement. So can you smile for me? And frown. Show me both your upper and lower teeth together. Good. Raise your eyebrows. Shut your eyes and don't let me open them. Good. I think I got them all. Puff out your cheeks. Good. And then the motor or the sensory, you can state and just ask, do you have any trouble tasting?
No.
So 8, which is acoustic or vestibulo-cochlear, you do whisper test, and with this cranial nerves, as long as that's intact, you can keep that. If you don't, they can't hear you, you can move to Weber and Renee. So let me have you cover up that ear for me and tell me what I say.
1, 2, 3.
And then cover up this side.
Dog, cat.
Good. Then the glossopharyngeal and vagus, you are going to ask the patient to kind of do a bunch of things. You want to look in the mouth with light. You want to see it in the relaxed state as well as doing the things that she's doing. So first of all, open your mouth. So you're just kind of looking in the relaxed state. nothing going on. It's sort of midline, no atrophy. Then you have them say ah. Good. You're looking for the rise of the uvula and the coming in sort of and closing of the posterior pharynx. Then you have them swallow, just to make sure they don't have any trouble swallowing. You aren't necessarily looking for anything, you just want them to swallow sort of in front of you. You are also looking for the voice as they've talked to you during the history portion. So mention that, but you don't need to ask them anything else. Spinal, this is where you probably could do the hypoglossal at the same time. We'll go right down the list and I'll come back. But the spinal accessory, have the patient's shirt off. You're looking at the musculature of the trapezius muscle in the back. So you're looking for fasciculations, that little fine almost tremor or flicker of the muscle, and you're looking that they're symmetric right to left. Then you want to actually check the strength, so shrug your shoulders for me against my resistance. Good. The other piece of it is sternocleidomastoid, so looking again sort of at the neck, making sure it's symmetric, making sure that there's no atrophy. Then you check again the strength, so turn into my hand. Good. And then this side. Good. Then the hypoglossal. You're inspecting the tongue again for similar things. So open wide for me. Good. And then stick your tongue out. Move it from right to left. Good. So in that, you're looking for that it comes out midline, that when she moves it right to left, it's sort of smooth movement that actually goes from right to left. I think that's it. Question.